So how do we use appointment types when scheduling an open dental? Well, first of all, what are appointment types? Appointment types are things that you can set up. If we go to Setup and Appointments, and then over here to Appointment Types. Now, I've got some set up here already, and my suggestion is don't get too carried away with these. Use a few distinct colors that mean something to everybody in the office. If you've got a zillion appointment types and a zillion colors, nobody's going to know what they mean. So what I've done is create one for Rocky, in other words, rock time. These are productive times, and one for sand. Okay, so we can just look at the color of the appointment and see that this is a sand appointment that's not very productive. That's the way I've done it. You can do this any way that you want. I also have some new patients in here and a new patient with a prophy, and I have some web scheduled ones in here. So I can just look at the color and know not only what kind of an appointment it is, these are kind of emergency appointments, but also where they came from. Did they come from the web scheduling or the patient call? Just by looking at the color of the appointment, I can see things like that. So if you look at the way Rocky is set up here, there's no procedures in there. And this is the way I suggest you do it, and I'll show you why. But look at an emergency patient. I do have procedures in there. Okay, I have a cone beam in there, and I have a limited exam, and I have my time pattern. Timex is what we call this, already set up. So when I go to schedule that one, it's going to automatically put these procedures in there, and it's going to create this time pattern. Now I can edit it if I want to, but let's never mind these guys for a second. Let's talk about scheduling Brad Pitt for some treatment. So I'm going to close that. I'm going to go into Brad's chart. So Brad has some treatment that we entered today, and we're not done yet. We're still back in the chair with the doctor and with Brad. And we want to not only put that treatment in there, but we also want to go up here and do a planned appointment. Okay, we want to get much better coordination between the front and the back. So I'm going to add a planned appointment, and here's where I can use those appointment types. Now I know this is going to be a bridge, so that's going to be a rock or rocky kind of appointment. So I can just select that, and now I can put the correct color in there. And now I can go in here and I'm going to do this bridge. If you notice over here, when I was putting that in, it was extending this provider time. Well, that's probably not enough time for a bridge, so I'm going to make that a little bit longer. And I'm going to have the chair side do the temporary, so we'll free up the doctor there. All right, so now I've done this planned appointment. I've done it just exactly the same way as I would if I was scheduling it in the appointment book, but I'm not putting it in the appointment book. I'm just planning the appointment. I want to go down here, insert the time by right mouse clicking, and put my initials, okay, and just say okay. Now I can do multiple planned appointments. If I did that one, maybe I want to add another one in here, and this time it's going to be Sandy because it's going to be the bridge seat. Here's my bridge seat down here, okay, and probably not enough time, so let's make that a little bit longer. All right, and again, I'm going to put date stamp it and probably put so this is really clear now. Anybody that looks at this can see not only is this number 1, but also this says 2 weeks after the prep appointment. So I can put more, I can keep going in here, and I can also change the order. If for some reason I wanted to submit before I prepped, I can move those up and down. So very versatile. Now we're all done here. So now I've got Brad ready to make his appointment. I'm going to look right over here on my dashboard, and this is the one that I want. So I can double click on this and copy it to the pin board right there. And now I can move this anywhere that I want. Okay, let's put him in right there. Now you notice the color of the appointment, which is the appointment type, moved with that appointment. So I'm going to say I put them in another doctor's operatory. Do we want to change the provider? Yes, that's fine. We never want to change the length though. Okay, so now I changed the provider, but didn't change the length. You notice this is the provider color, which is separate from the appointment color. Okay, so now let's go out 2 weeks, and I'm going to schedule his next appointment. I'm going to do the same thing. I'm going to double click on this. I'm going to copy it to the pin board, and there's my appointment, and I can drag it right over there. Okay, change the provider, yes. Don't change the time. Okay, so now we've got both of Brad's appointments scheduled. Let's say Brad has some other treatment in there. What if we want to schedule a filling? So let's go out a little bit further here, and we'll double click right here, and we'll say, yep, that's Brad, that's what I want. I want to create an appointment. I can go up, I've already got these set up. I know the filling is going to be a Sandy appointment, so I can double click on that, and now I can go find my filling and put it in there. Again, I want to go over here and maybe change this. I want to date stamp and put my initials. Okay. And there we go. I put it right in the book, even if it didn't have a planned appointment in there. So using the planned appointment is just in general going to make things a lot more efficient. And one of the steps in creating a planned appointment, if you're going to use appointment types, is to put the appointment type in there. So spend a little time, again, appointments and appointment types, playing with these things and getting them the way you want them. And so what we suggest are two different kinds here. A rocky time, that's a productive appointment, and a sandy time, that's not a very productive appointment. So this will help you with your block scheduling, which is a different, totally different topic here, but this will feed into that. So my advice is don't get too carried away trying to make too many of these things, just because then people won't know what the colors mean. Now it's really easy to look here and see that this is a sand appointment. And if I went back to one of my previous appointments, you can see at a glance whether it's sand or whether it's a rock. If you like this video, be sure and like it and subscribe, and also click on the bell icon so you get notified about future videos. You might also think about sharing this with some of your friends. If you'd like some other tips on how to make your office more profitable, please give us a call. That's what we do.